thank you for this opportunity to share some thoughts this morning from Fiji. I've been listening for the first panel and now into the second panel, and I've been very pleased with the discussion so far. They seem to reverberate with some of the thoughts that I, as a minister in the low and middle income country in a small island development state, often think about as we think about how we can be able to continue to push and pursue universal health coverage. Because the initial topic that we're talking about, which is about ensuring that women have care and ensuring that they have sustainable solutions from end to end, really it's about ensuring that we have a universal health coverage in the way that I think of it. Ensuring that we have a very strong primary healthcare approach, secondary healthcare, tertiary level healthcare, and back again. And there are opportunities for both the public sector and also the private sector, even in small island countries like ours. And we found that that the public sector alone cannot do everything. We need support from the private sector. And so there are some things that we have done to that regard. We've outsourced GP services so that family medicine is done by private GPs rather than in the old scheme National Health Service medical centers. So we've started outsourcing that. We've entered into a public-private partnership with an Australian-based company to be able to provide tertiary level care at one of our other hospitals. So we have 3 main hospitals. We've entered into that, and included in that is working with IFC and is actually ensuring that they will be able to provide 24/7 open heart surgery, radiotherapy, things that we cannot be able to do in the public sector because of the challenges that exist, the challenges of not having the human resource personnel, not having the backup such as the radiophysicists readily available. And therefore, the private sector is able to accelerate some of the work that the public sector cannot do. So there are opportunities, and I sincerely feel that whether it's a standalone private sector investment that supports the work that the public sector do, or support of the private sector directly into the public sector, into the work that we do. Now, I want to talk about low and middle income countries and small island development states and the challenges we face. We all know that after COVID, if you look at some of the articles that's come through, I think there was a Lancet article recently which showed that a lot of countries around the world, and especially the low middle income countries, are struggling with a setback in terms of their normative work. So, it's the work around vaccinations, the work around maternal and child health, nutrition, NCD. Those have all been put on the back burner because all the resources have been concentrated on COVID-19, which includes work around women's health. We have to understand that. So they've all been put on the back burner because all the resources, the limited resources that existed, have been pushed into actually responding to COVID-19. So now we're in a catch-up phase. We're trying to catch up. We're trying to be able to find the women that should have had their pap smears done, or the HPV tests, the girls that they should have had the HPV vaccination done, get them to have the vaccination. Find the children that missed out on the expanded program of immunization. Determine the NCDs that have, in the community that have been non-compliant to the medicines because they've just not been able to access because of lockdowns. This is actually the catch-up period. This is actually a time where we need that investment, where we need that support to be able to, again, accelerate and bring us up to norm. Because it's becoming very clear that if we don't do that, a lot of countries are going to miss out.
Hello, anybody here?
Being able to.
Hello.
Yes, we are here. Please, you can off your volume again. So a lot of countries are going to miss out on the 2030 UHC target that we all targeting, unless we have investment to be able to support us in that regard. So thank you, Ki. maybe that was a sign for me to stop. Thank you.